So I thank you all for attending. I am beyond excited to moderate this session. I hope today that out of this you guys get a story of true creativity and innovation using what we at AWS call a pan-Amazonian approach during this public health emergency in COVID-19. Before I invite our panelists on stage, I would just like to set the stage a bit around the project and the threads of the partnership that you'll see up here on stage today. In the spring of 2021, the National Institutes of Health in the US and the Centers for Disease Control and Prevention, the CDC, created a project called Say Yes COVID Test, for which it was to supply rapid at-home COVID-19 tests to vulnerable or rural communities. Care Evolution was contracted for this project to spin up an online solution for folks to order these tests, powered by AWS, and as well figure out how to distribute the tests, starting in the state of Tennessee, to homes and community centers. They needed to figure out a distribution mechanism for at least 160,000 at-home COVID-19 tests. This effort kicked off the partnership between Care Evolution and Amazon to explore how to use Amazon's multi-channel fulfillment services in order to get tests into homes. This initiative was so successful that Say Yes COVID Test launched into 18 states, including the state of Washington, and to date has delivered 13.6 million tests to homes. Then, during the Omicron variant surge, Project ACT was founded by the Rockefeller Foundation. It leveraged the solution created by Care Evolution and Amazon for distribution, and in 2022 deployed into 6 states. To date, 1.1 million tests have been delivered to homes using Project ACT. So each panelist that is about to join us on stage represents a thread of this project, and I hope that we get to dive deep a little bit today on that. Come on up, guys. So before we dive into questions, I would love for each of you to just spend 1 to 2 minutes telling us who you are, what part of the partnership you represent, and a few opening remarks.
Yeah, my name is Andrew Sweet, and I'm at the Rockefeller Foundation. I'm currently the Vice President for Global COVID Recovery and Response. And that really entails overseeing a $55 million global vaccination initiative. But for the past 2 years, I was overseeing the US response, really starting in March. And we did a number of things early on in testing that really took hold. I think the first thing we did was we actually put a national testing action plan together in April of 2020, saying the number of tests needs to skyrocket and the US government needs to invest significantly in tests. And we set a goal of 30 million tests per week by October, and we put that plan together with former FDA commissioners of both parties. We put that plan together with Nobel Prize winning economist Paul Romer and really advocated for its implementation. We also, you may remember that the states were competing against one another for scarce resources of tests, and that was very much a luxury thing throughout the summer and beyond. And you may remember Governor Hogan sending a plane to South Korea to secure rapid antigen tests. So Governor Hogan called us, who was then the head of the National Governors Association, said, hey, can you help coordinate the states, because we're really competing against one another, and we think if we can cooperate, we can bring down the price and create a market. So we created an interstate testing compact. And a third thing that we did is we established the first testing pilots for K through 12 schools. We're able to secure a number of rapid antigen tests from HHS when they made the bulk purchase agreement with Abbott in the fall of 2020. We got those tests quickly to schools throughout the country. We brought on Mathematica and RAND to develop the evidence and produced a number of reports. And so we came, as Betsy said, we came really into this around Thanksgiving. Actually, I got a call the day before Thanksgiving saying we got to do something. Say Yes COVID Test is an amazing project, and we want to try to scale it. So that's where we kind of came into it.
Thank you. And Vic?
Vic Cathewell. I'm a physician informaticist that I work at an entity called Care Evolution, and we've been around for the last 18, 20 years. We're focused on what we call connecting healthcare. And in this particular case, I think our work started in early 2020 when the first cases started to appear in China. We were doing a lot of work with the NIH to basically sponsor and power studies to see what longitudinal outcomes were for patients who were, let's say, the Framingham Heart Study, the ideas of risk factors and so on. And a small little group in NIH started to get together in March or April of 2020 to think about the pandemic and what to do and the ideas around testing. And you may remember, PCR testing was tough back then. There were long lines. There was a real supply-demand issue. And a lot of the leaders and scientists at the NIH, National Institute of Biomedical Imaging, NIBIB specifically, had this idea that you ought to be able to do lateral flow assay antigen tests at home. New technology, you don't have to wait 2-3 days to do this kind of a thing. You ought to be able to take a strip. Now we all are very familiar with it, but it was really a provocative idea from Dr. Bruce Stromberg, who leads the NIBIB, to say this science exists and we ought to do something about it. The nation's going to need it, and NIH started to work in that. The RADix initiative was born. Studies were being done, and by the mid to late summer, we were beginning to see that it in fact was possible not to think about can we do 10,000 tests a day or 100,000 tests a day, but we could do 10, 50, 100 million tests a day because you didn't have to go in to get tested. You could do it yourself. So each one of us, 330 million people in the US at least, could do one of these tests ourselves, right? It scales really well when you're able to do things yourself. Long story short, we were participating in the validation processes around this kind of a thing. And by the end of the year, the notion became these tests exist, but mostly it was done by proctors. And if folks were going to do it at home, we needed to see and create a real-world experiment in a couple of communities and seed those communities with tens of thousands of these tests and see if people know what's called the anterior nares, front of the nose, that they don't stick the swab in the wrong spot, that they actually have, sitting at home, they don't get distracted because, everybody was baking bread around that time, that they don't leave the strip in there for 20 minutes instead of 10 because the performance of the test would be compromised by that. So a real-world experiment had to be done to see, can consumers who do not have training in how to perform tests, can they do that for themselves? And that meant somehow getting tens of thousands of these things in the community at the same time. And one thing led to another, and we're like, you can't have enough churches and YMCAs and pop-up tents. How might we do this? And, Uber Eats was working and Grubhub was working, and everybody was accustomed to ordering stuff online. So one of the ideas for distribution was, why don't we do the same thing? And we called up a couple of friends at Amazon, and literally they created a solution working with us where consumers are able to do that. So that's the heritage of sort of what we do, how it started from science, and part of the science is the efficacy for the consumer at home to be able to do things and not necessarily rely on burden and already completely overwhelmed public health infrastructure.
Thank you.
Was it overwhelmed, Dr. Shah?
A little overwhelmed.
Dr. Shah can certainly speak to the overwhelmed public health infrastructure.
Well, first of all, Betsy, thanks, and Andrew and Vic, just a great partnership. Just thank you I'm looking forward to this panel so much. This has been incredible to really describe this partnership, and I would be remiss if I didn't start by thanking first our Deputy Secretary for Innovation and Technology, Les Becker, who's in the front row here. Les has been just incredibly both innovative but a leader in how do you bring solutions to public health challenges or public sector challenges throughout his career, and especially at Department of Health after he joined. And so I'm just really, really pleased that he's part of our team. I also have to say that our governor, Governor Inslee, Jay Inslee, if you are not aware, is probably the most innovative and pro-health science governor out there. And one of the things I remember is in the spring, I guess it was really January. By the way, I'm from Texas. I should have said this. And so there's this really odd dynamic when we say spring and summer. I am very not sure what exactly that means right now, because in Texas it's 95 and in Washington it just turned 65. So it's just a very, very strange dynamic. As background, I'm a physician. I was previously the health director at Harris County Public Health, which is the county health department for the third largest county in the US in Houston, with about 5 million residents. And we created a lot of innovation and activities that were very much about how do we tackle really challenging public sector issues. In December of 2020, after being on the front lines of COVID-19 response in Houston, I was asked by Governor Inslee to come and become the Secretary of Health. I arrived 5 days after vaccines arrived in the state of Washington. And I will tell you that year plus was a blur in terms of every single thing that we were doing. And as you know, it was first about vaccines and trying to protect people. And we were one of the better states, 13 plus million vaccine doses that were given out. But when we flipped the script, and this is really exactly what Andrew and Vic just talked about, is that it was really at the end of the day empowerment of community. And that was really what testing and providing tests to people, consumers, individuals, residents in their homes is all about. Our cornerstone values are equity, innovation, engagement at Department of Health. Those three cornerstone values very much were a part of this program. Absolutely, we start with equity. It's centered on equity. It's about innovation, but it's really about engagement. And so when the governor said in January, hey, we've got to figure out a way to get COVID tests to people so that they can make good decisions, we went back to a program that had started in the fall, which was really very much NIH funded, which was in Eastern Washington. It was a Say Yes sort of COVID test precursor to our program. And it was really for 17 counties. And it was about 800,000 tests that went out. And it was really, if you will, trying to make sure that everything worked to, as they say, you cook it and you try to figure out if what you cook up, the meal is going to actually be both delicious but also healthy, because I'm a doc, I have to say healthy as well. And so in January, we started with this problem that we needed to and we wanted to empower people, so we were not in this real incredibly difficult public health challenge of overwhelmed systems, community testing. How do you go to drive-through testing sites? How do you wait a day or half a day to get your test result? People who don't have transportation, people who are scared, people who are just worried about what am I going to do to make a decision tonight about tomorrow morning, and they can't get to a spot to get a test. Well, guess what? The solution comes in. And what we did then was partnered with both AWS as well as Carevolution and certainly Rockefeller Foundation with this initiative to not just be in these 17 counties, but throughout the state of Washington. And you were a consumer, you could order tests, and within a day, it was at your doorstep. Mm-hmm. How powerful is that to make decisions on what you can do for yourself, your family, to make sure you're protected or those around you are protected if you have been either exposed or you have symptoms to COVID-19. That's what this initiative was about, and so we're so excited to be a part of it.
Fantastic. Yes, I forgot to mention that you guys had created a statewide initiative out of Say Yes COVID tests, so thank you for touching on that. So I think we've heard a few challenges. Certainly in looking back over the past 24 months, we can think of a lot of challenges in the public health agency setting and company setting and foundation setting. But certainly from the individual perspective in households. And when we think about what you talked about with your pillars, specifically equity, we do need to consider the fact that not everyone could get to a retailer in order to get a COVID test. So we really needed to come up with some sort of creative solution around how to distribute the millions of tests. Vic, do you mind talking a little bit about how you guys came to the inception of this solution from essentially going to an online retailer and getting something delivered to your door?
I mean, this is the old adage of necessity is the mother of invention. And you got to remember 2020, one of the biggest challenges was the pace at which sort of the science and information and data was moving. Testing was a very fast-moving space during that year. Serology testing, have you developed antibodies to that? Is that going to be the right way? PCR testing, is that the right answer? What's the gold standard? Antigen testing, is that the right answer? Capacity issues. And that was one fundamental problem that was going on during the course of that year. And to understand which kind of test is best positioned to inform things. So if you're trying to figure out who has ever gotten COVID because you're trying to run a study or understand within your population, that may be answered by a different kind of technology. If you're trying to ask the question, and by the end of the year, as yet another peak came and we were, our hopes were dashed, I think we all started to go, the number one thing we wanted to do with testing was to see if I was going to pass it on to my mom or my grandma or spread it, right? That became a profound thing for consumers to say, am I infectious today? What is my transmission risk? And this particular kind of test, the home test, actually, I would suggest is probably the best one we have to inform that decision. I say all of this because the point became there was a lot of things to manage, challenge on the science. What should we even distribute? So there were fundamental scientific questions to figure out and clarity, and the public didn't know. And so working with departments of health, working with folks from the CDC and others who were trying to come up and say, this is a test for this kind of a reason, but at-home testing is really good if you're trying to make a decision how to conduct yourself later tonight. Do I go to the birthday party? Are my kids having a sleepover or not? Those kinds of decisions is what we were all running into. And we did not have the luxury of waiting 2, 3, 4 days. You might remember pictures of folks lining up in stadiums across the country when the peak came. So there's issue of how fast you were able to access a test, and more importantly, how fast were you able to get results from the test? Both were very important challenges. The second thing that I think was challenging and remains so to this day, because I think in February of 2022, the Omicron surge came, the shelves in the Walgreens and the CVS's and the Rite Aids of the world were empty. Signs were beginning to show up to say, we don't have COVID tests, right? Even though we had hundreds of millions, so we have this Swiss cheese problem over time where, it does not impact us in a stable way. So you needed a way to sort of be able to flex capacity and go when you needed to, where you needed to. So pre-positioning tests in certain zip codes and have them sit, because there's also this expiration date problem that the test is good for 3 months or 6 months or 9 months. How do we deal with these kinds of things? So, our approach to that was, this feels like a logistics problem. We've got, in order to do the right thing, we need to get things in the hand of a consumer. This is not about getting things in the hands of necessarily professionals. It's not about getting things in the hands of hospitals and emergency rooms and urgent cares. They have business-to-business ways of doing those kinds of things. But this is fundamentally, with this technology, about getting it in the hands of the consumer, and how do we affect that? And you may recall, we also launched a national plan to get 2 or 4 or 8 tests. But that was designed to create, I think, a sense of having something in your hands and on your shelf as a backup. But if you needed a test now or tomorrow, waiting 2 or 3 weeks wasn't viable. So our answer was, most of us had lived through Amazon Prime. And the shocking thing was there was times that they beat their promise date. And I think it was that simple for us to sort of reach out and say, is there something that is able to meet the acute need anywhere in the nation, has the background where we don't have to worry about which county we have to place the test, et cetera. Somehow they have that infrastructure to do that. And that's basically working with the APIs that Amazon Web Services offers against the fulfillment operation, this whole thing called multi-channel fulfillment. The answer was how to create an app, which is what Care Evolution does, that enables a site, that enables a consumer to say, I want to order a test. They share their address. You validate that it's a deliverable address. You have to do some things so folks aren't hoarding the tests, things of that nature. You want to do precision distribution, that you might want to open up the ability to order to certain high SVI or social vulnerability index kinds of geographies first on a preferential basis. You might want to manage the total order volume such that you reserve certain stock for those who don't have ready access to digital and might have to go to the library. You might need to implement solutions like the 1-800 line that I think the Department of Health offers. So those who do not have access to broadband or the ability to go to a site, they can call a 1-800 and somebody will enter that order for you. And so somehow reaching both who have digital skills and don't have digital skills and be able to accommodate them. And in a front end that, no disrespect to our wonderful Amazon colleagues, but they were the first to say, we don't want to make people make an Amazon.com account, right? They might not want to share that information with us. There was a lot of stigma in the early days about this thing. Folks may not want their neighbors to know what's coming. So the anonymity of just a standard Amazon smile box showing up, you don't know what's inside, and you haven't shared any personal identifying information with big tech, if I may call it. So the Amazon team was very helpful to say, you all are the front end. We don't actually do anything with the data other than in the service of delivery. You maintain the privacy and security and the trust that you need to build with the community and grow that trust to make sure they're not getting advertising, all the concerns appropriately that folks have. And that ended up being the solution.
Fantastic. I hear a theme of earning trust with constituents in your answer. And we have a saying here where trust is hard earned but quickly lost. So in thinking about that, Dr. Shah, having the risk of implementing a creative solution and aligning that with a distribution channel that has a proven track record, how did you see the relationship bloom or the trust bloom between the Department of Health and constituents in the areas that you launched this program? And are there any lessons that you would take into future response efforts that would help maintain that trust so it's not lost?
Yeah, that's a great question. I actually have some quotes that I'm going to, at some point, just somebody remind me to read a few of these from consumers, Washingtonians, what they actually said to us. So I want to make sure to put that here. But I have to say something about what Vic just said. And if it's okay, I'd like to go back to something that he said very eloquently, by the way, which was all of these, which I couldn't even follow, all these different, care distribution model. I don't know. You said all this stuff. It was very technical to me. I don't know what he was talking about. I have no idea what he just said now. But I will tell you, and this is the key thing for a partner, right? We didn't know any of that. But what we did know is that, look, if I'm trying to get a package somewhere to somewhere else, or if I'm trying to buy something, I know that there is a way that overnight we're going to get it, right? Or 2 days we're going to get something. That's what Amazon Prime is all about, right? It's you get it overnight. We didn't know all the back end of what that required. All we knew is that the track record is pretty dang good, right? Sorry, that was a Texan thing. Dang good, right? Pretty darn good. And that track record is that essentially you get on a system, and Vic is right, that it wasn't just about a computer entry or web entry or mobile entry. It was also that you could call a 800 number that, by the way, had language line help, 140 languages. We eventually created 37 languages that you were able to to actually access this. And so there's a lot of an equity approach. But we knew that we had partners in our backyard. I think that's the key message. So, right, shame on us if we're in the state of Washington and we have these incredible corporations, companies, private sector that are right there, that are handling solutions for across the globe, and we don't even ask them, could you help us with the public sector issue? And so this is where all he said doesn't mean anything meaningful to someone like me, because I'm essentially a consumer of that material. And so what I'm doing is saying, I know this works. I didn't know Care Evolution, but I knew Amazon. So we called up and said, hey, maybe we could ask Amazon to help us. Amazon had the relationship with Care Evolution, the relationship with Rockefeller, and all of a sudden, a public sector partner who has no idea of all the tech and all the background information makes one phone call, and it starts the entire process. That's what was so cool about this, was that we didn't know all of the background that takes to make things successful, the distribution channels and all. But you know what we do know is we have consumers who want something. We have Washingtonians who are saying, we want to have tests to be able to make decisions. We have a public sector problem. How do we get tests to them? How do we do that? Do we do it ourselves? Do we go with, this system that, okay, call us at the Department of Health and we'll create some laborious process, and that's what government does, right? This laborious process, multiple checks, and we'll finally go through a system, and yeah, in about 6 weeks, you'll get something, and perhaps it'll be a letter that says, sorry, we haven't been able to fulfill it, right? And then we'll come. That's usually the stigma against government, right? But when you bring private sectors to the table, those partners are able to streamline all of that. And so 6.5 million kits later. Think about that. 6.5 million test kits later. What we have learned is that there are so many things that we are good at in the public sector, and there are many things that we are not so good at. And that's where the partnership comes in, because Vic and Andrew and all the teams that were involved from AWS, they came together and said, what can we do to help you? And they did. And so the consumer at the end of the day, and again, but just remind me, I've got to read this at some point. The consumer at the end of the day had an experience, and that's the thing that we oftentimes forget, is the consumer, the customer, the individual, the resident experience was a positive one. So when they came out of this, they felt not that they were already, from a mental health and a behavioral health standpoint, people are panicked, they're concerned, they're worried. That is why we have seen so much diatribe throughout this nation, where we have not seen people to be able to come together, because we're oftentimes panicking about the next thing, Omicron or this wave or that wave or increase in hospitalizations. We've got to provide a way for consumers and people to feel connected. And that's what this project was all about.
And now you need to read the quotes from the people.
Oh, I need to. Oh, okay. Now, okay. Here we go.
If this is a good time.
This is a great time. For those laughing, you don't have to order any. No one is forcing you. Myself, I'm thankful for access and the opportunity to know if my husband, who works with the general public, has potentially brought it home to our medically fragile toddler, or if it's just a sniffle, so we can take appropriate steps to protect him. This so makes sense, by the way, second one. This so makes sense. With 5 people in the house and all having different contacts, I'm grateful to have them around. Number 3, more are coming. They distributed what they had in stock rather than holding on to it. Thank you, Washington. Number 4, wow, I got my order yesterday, less than 24 hours in between the order and delivery. Thank you so much. Number 5, wow. Okay, I don't know, the same person, but different person. A lot of wows in Washington. Starts with a W. Wow, I'm impressed. Got 4 tests 2 days after ordering, delivered by U.S. Postal Service on a Saturday. That is what it's about. And so I'm on social media, I'm on Twitter, YuShaMD, and I'll tell you, opening up your Twitter feed lately has been really hard, right? People are coming at you with negativity. So all of a sudden I had all those what are those things called? The notifications at the bottom, and you're like, oh my gosh, they're like 30 notifications. I don't know what that's, I don't, clicked it, right? Thank you. Competence, this is great. You did something amazing, wonderful. it was amazing to get that kind of feedback on a program that we launched in partnership with those who knew how to get to the consumer. And that's what this partnership was all about. So, thank you.
Thank you for sharing that. I think it really does underscore that earning trust, and especially, like you said, government does some things well, and private industry can help where it's necessary. So it's important to note, again, that Say Yes COVID Test kind of started this whole thing, but Rockefeller took that model and launched Project ACT. How did you see the partnership model evolve, and how do you think it impacted equitable access to those in need, or potentially to get other goods to folks that may not be able to leave their homes?
I remember very clearly how it started because my boss, the president of the foundation, called me the day before Thanksgiving and saying, we got to do something about this. There were a number of tests that were recently authorized, big volume tests, mainly Chinese manufactured tests that were going to be manufactured in the hundreds of the millions. And so the challenge is how can we get these tests out to the households who need them the most, the hard to reach, the people who can't afford them, the people that can't go to the pharmacy. And so I spent the rest of the Thanksgiving break on the phone with folks at HHS and the White House trying to think about a model. And through this network that we created with the states, the State and Territory Alliance for Testing, of which Washington is an incredible member, we said, let's do this. Let's scale Say Yes COVID Test, and let's use our philanthropic resources. So we spent almost $8 million to purchase 1.1 million tests and all of the other services, the amazing services that entailed, to get those out to vulnerable citizens across 6 states during the peak of Omicron. So that was a really powerful experience. I mean, and it was an easy, awesome call for me to make. I could just call these health department directors, do you want 200,000 tests delivered directly to your citizens' doorsteps? It was like, not all days were great over the past couple of years, but those were great days, making those phone calls. And the beauty of the model is now that this is being sustained without philanthropic dollars. So now states are seeing the value in this, and what we've done is we've set up a system through our public charity where we are the aggregator. And so now we get, listen to this, federal resources flowing through states who are giving us grants to purchase the tests from a Chinese manufacturer, iHealth, at $4 a test. And then all of the logistics and distribution that entails. So we've gotten that price per test plus the logistics and distribution down to $6.10. And so that's just an incredible number. So the price point for these states is incredible. The other thing is the data that they get is also highly valuable. Every day they get an automated report about how many tests have been ordered, how many tests have been delivered, and every week they get an Excel saying how many tests have been delivered at the zip code level. And so that information is really, really valuable. But for us, the exciting part was seeing this model. I think imitation is the greatest form of flattery, and fortunately we could just kind of step into a ready-made partnership with you all and expand it. And so now we're kind of still in the middle, but not using our philanthropic resources and just serving as that aggregator. And so we feel that this is just a perfect kind of public-private partnership, and we're very proud to be a part of it.
Fantastic.
May I?
Yes.
So there's a really interesting thing we haven't touched on explicitly, which is a different kind of a Swiss cheese problem where funds are available, but you can't put them to effective use when needed, right? So, you could have FEMA funds versus CDC funds versus state funds versus federal funds. You alluded to this, and I think part of what, as the pandemic, there's a massive peak, and you have to do whatever it takes. You're in emergency mode. But living with this, and whether it's this or strep this fall or flu, I think there is a new sort of realization across municipalities, state departments of health, and federal fund dollars to say, how do we turn this into something sustainable? So this is not a one and done kind of a thing, because we're going to need potentially a monthly allocation of this. And we might have a baseline allocation of how many tests are needed when we don't have a huge peak, and we want to be able to scale up or down. So that ability to flex with financial dollar flows and be able to marshal those resources and be able to put them to work in an existing working playbook. That's a lot of what I think Rockefeller has been able to do, is to create a playbook for states to figure out, I have dollars, but I don't know how to put them to effective use. And you can't, the brick and mortar approach of asking consumers to leave their home precisely at the moment that they're thinking, I might have COVID, so they can get in line somewhere else, shoulder to shoulder with somebody else, to say, I'm here to make sure I'm not infectious. It's a chicken or the egg problem, right? And the second thing that I think is beginning to happen, and why this is about pandemic preparedness or public health, is this notion of, I think there's more digital literacy than we imagined, right? The consumer has matured and grown a lot over the last 2 years, because they can't get an appointment with their physician without using an app. So the world is not where it was even 4 or 5 years ago. While digital cannot be the only model by which this can be done, and so you create hybrid models. It's not an either or, it's a both and. So yes, you can do self-service that maintains privacy. You can do it at 11:30 at night. You don't have to look at business hours when you want to order the test. It literally arrives at your doorstep. And you don't have to be there, because no signature required. The freedom that affords people who have, that aren't working from home, that they actually have to go to work, folks who have transportation issues, folks who have disabilities and can't leave home, socioeconomic stressors, to say, this is not how I want to spend my hard-earned money or spend on gas to do that. So a lot of the work we did, and sponsored by the CDC and NIH, was we actually conducted for the first 9 states market research through a partnership with Research America, to see what the attitudes were of the public on the various models by which they wanted to get tests. And every single time, all 9 states, irrespective of race, gender, level of education, ethnicity, language of choice, digital ordering was the most preferred option. It's not the only one. So you want to use 1-800, you want to be able to deliver it. Some people still want to show up to a distribution site. We're not making all of those go away, but from a, thinking about multiple arrows in the quiver to tackle this, I think this is one of the big epiphanies for us. And a lot of the data you're mentioning, the zip code analysis that I think a lot of county level health departments are learning, is they are finding that it does not necessarily exacerbate the inequities we have, particularly in getting to rural and other areas. You have to be careful about how you manage that. Again, how you open the ordering site, how you manage those kinds of things, how you track it, so those who are most savvy don't use up all the stock in the first 4 hours. So those are the kinds of things we worry about, as an app, to make sure that that equity is maintained through the digital experience. And I apologize, I'm saying, there's one thing that I think on the Amazon backend folks don't appreciate that's really important, and I think even the original equipment manufacturers, those who actually sell on Amazon.com, part of the partnership and understanding, I think Matt is here somewhere, the logistics team, we're digital, but it's the intersection and the mashup of digital and analog where everything happens. We're not robots. In the end, we're trying to reach moms and dads and, husbands, wives, significant others. They're human, and they're going to interact with a physical object. And I think the project was all about that. So simple things about not letting folks down across Washington or the Rockefeller Foundation was to think ahead. If we bring you 10 truckloads of stock, how long does it take for that to be positioned across a national network so that 2-day delivery can be achieved? You got to think ahead, those kinds of things. So, working with our Amazon partners, we started to understand what that is. And part of what we do is we plan ahead, just like before, which day should Project At launch? Yeah. We're like, we want to make sure the stock is pre-positioned, that there's a certain fulfillment rate on the back end, that it's moving about. The consumer doesn't worry about it. Dr. Shah's team doesn't have to worry about it. But what you want to be able to do is people just, I ordered and how fast did it come to me, which means you've negotiated certain pace with the original equipment manufacturer, how they're going to inbound the stock, how we're going to distribute it across the network. And that is all the logistics behind the scenes that this solution sort of hides the complexity, but there's a lot of cool stuff going on to make that wow happen.
Right, and to Vic's point, we at the peak it was 80,000 test kits a day that were being delivered, and we are now maintaining 5,000 test kits a day. And over time, one really interesting way of looking at how you're seeing disease burden and potential people wanting to get tested and/or anxiety in a community is to actually monitor how many tests are being ordered, right? Because that will be a way ebb and flow of what you're seeing. So that's an example of where public health has not been able to do that because we're frankly have been quite busy. I don't know if you've known that for the last 2+ years. It's been a little bit tough. But the other piece, and this gets to what we talk about very much about, and I'm a big believer in alliteration. So it was equity. It was absolutely about empowerment, right? And it's also about effectiveness, because if you have effectiveness, without effectiveness, you're not going to beget. But it's about experience, the experience of all that coming together. And that gets to engagement. And so, yes, there's a lot of effort, but there's a lot of this equity and empowerment and engagement and really the effectiveness of these programs that really begets the experience of the individual. But I think one thing that we all have to remember is that as we're looking at these public sector issues, they're not public sector issues. So I've said that multiple times. I'm going to pull that set of words back. These are societal challenges. These are challenges that we as Americans have right now. It's not about public, private. This is not about the us, them, either or. It's about all of us coming together and trying to understand better how do we solve real life issues and do that in a way that's going to be acceptable to people. All of us know that this has been a challenge to try to get people vaccinated, right? There have been two parts of this equation. Some people are like, yeah, give me like the next booster. And then there are others like, I don't want any of that, right? Same thing with masks, right? I got my mask in my pocket. We're all vaccinated, so we don't have to put it on. But I will tell you that at the same time that, the masks have been this political divide. Interestingly enough, and I've been thinking about this lately, testing has not been divisive in our nation. Have you noticed that? Vaccines have, masks have, every other thing about this pandemic has been divisive, but not about testing, right? Nobody has said, you're not gonna, we have all been willing to get tested. Fine, I'm not gonna get vaccinated. I'm not gonna wear a mask, I'm not gonna, but fine, you can stick that thing up my nose. People are willing to do that, which is shocking to my 5-year-old, right? Like, what? Really? People want to do this? Dad, they want to do this? Yeah, we sent 6.5 million of these test kits out. Really? They want to do this? Why don't they just get vaccinated? I mean, there's a lot that's out there. So think about how do we bring cohesiveness back to our communities? Because that's what this is about, and this is Vic's point, and Andrew has made this as well. Not a one and done. How do we leverage these partnerships, these experiences for ongoing issues that we can all come together for?
It's like I paid you to say that. It leads me into my next question. I hear...
Hopefully to Andrew this time.
Oh, no, you're...
That's all I got. That's all I got.
Yeah. I hear, what the themes that I hear throughout what you all are saying. I mean, certainly, Vic, I would be remiss as an AWS employee to not mention you essentially talked about cloud services and the ability to scale up and scale down and sustainability and cost. Certainly, with your point, Dr. Shah, around bringing people together around a common cause that is not divisive at all. I would like to ask all of you to think about, are there any specific lessons, good or bad, that you learned through this process that we can take into something sustainable, whether it's in public health or potentially another government program?
Well, I think the one is that, we've talked about is that don't let your own limitations be the limitation to the initiative, right? So just because we had limitations where what we could do or not do, that didn't mean that we didn't have partners that we could bring to the table. And we do want this not to just be a one and done for the state of Washington. We want to be able to sustain this for other models for the future. What are other ways that we can deliver services or deliver activities or deliver certain kinds of products, if you will? That's not the right word for us in public sector. It's a private sector word, but there are products that we deliver, whether it's vaccines or it's something else that we're doing. There is so much that we do that is ultimately given to a consumer as the public's health, and we want that model to be something that can be scaled across the nation and across the globe. Frankly, there is a domestic global intersection that we also believe very strongly on what are the things that we are doing that we can learn from other parts of the globe and or country, and vice versa. What are things that we're doing that we can export to other parts of the globe or the country? And that's where Andrew types come in, right? Rockefeller Foundation come in, because it takes an initiative and it puts it into a way to, almost, as Les has said many times, incubates it, and it becomes an organic activity because of a need, and you incubate it for something that can now be taken to other consumers and or other states or even other nations to be able to solve problems. So I think that's what we look at, is how do we take this to that next level? And we also recognize that success begets success, right? So you do it once, you do it well, great. But like you said earlier, you do it unwell, that's it. That's your one shot. So make sure you really work through all those logistical challenges, because if you don't want to launch it, and I remember Lacey Fehrenbach, our Deputy Secretary for COVID Response, she said this so well, we want this in medicine cabinets. It's just as like you have a first aid kit, you've got a test kit, right? And I remember her saying that and all of us thinking, that's an interesting concept. But gosh, how are we going to do that? It's not like, we're a little behind Band-Aid. I mean, they've got Band-Aid, they're Band-Aid and they're everywhere, right? Everybody's got toothpaste. And we're a little behind that because these test kits just came in the last year that we're trying to get out. So this is really an opportunity for us to socialize a way to protect people's health.
For me, it's just, I think the lesson for me was trusting quickly. I mean, the Rockefeller Foundation is a very old institution. It's a centuries-old foundation, and I think what I wanted to be sure about is how can we not let our partners down, that we weren't slow with our processes and our diligence. And Vic and I had a number of conversations about this, because there's this new innovative model, and we have the Carevolution and Amazon and the Chinese antigen manufacturer, and there was a lot of no. And part of it was trust by proxy, because we could have a conversation with the NIH and be like, trust them. We've been doing this for a year. It's phenomenal. If you guys can come in and kind of scale this, we would be grateful. At the highest levels of the NIH, I could go back to our general counsel and just be like, please, 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 if we don't move now, we're not gonna be effective. And because of that, we were able to move almost $8 million in a matter of weeks to get this up and running. And we could do it still during the peak of Omicron. And if we hadn't been able to trust quickly, we would have been ineffective. And that was a huge lesson for us. And I hope we can trust quickly going forward, and not just in a crisis moment, which is a huge lesson. And even if you don't know the partner, or how is the website going to work, or what do they do with the data, if you have a partner that can vouch for them that you trust, hopefully that will be enough. And it sure was good enough for us, and it's been good enough for us since.
Any lessons from your end, Vic?
I suppose just, reflecting on the comments made, I think it's like having a cool tech solution is useless.
Cool.
It's cool. But to actually have folks who pull you into the fold of workflow, the comms team, we co-wrote what a press release should look like to set the appropriate expectations with consumers, to be able to call on and sort of have open the kimono a little bit, so to speak, and to say, hey, we need to insist on X, Y, Z. We need to delay it by a week so the site doesn't fall apart. These kinds of conversations, everybody talks about trust, is sort of, they're chicken or the egg kinds of things, but you have to commit yourself to a solution, not stay within your zone and silo to say, our app was working well, something happened to the truck when it was being inbounded at the cross-dock facility at Amazon, that's not our fault. I'm like, no, everything is everybody's. It's not a fault or not fault, you kind of have to, it's the old, the Apollo movie, they're up there. These are the parts they have. We have 5 hours of oxygen. Let's figure out how to do it. And the cool thing was that I think the pandemic and the rigors the crucible that it represents enabled us to work that way. With Rockefeller Foundation, with Amazon, with Research America, with NIH, with Department of Health and state entities, who all have very appropriately fiduciary responsibilities for due diligence and certain processes, but you sometimes have to, and I wonder if we can't do it more often, because I think it ends up with a good solution in record time, because we need it. So I think that if there's a lesson, I don't have an answer, it's more of a question, how to bottle that up the next time we don't have these, is the word, exigent conditions under which you have to operate.
Lots of ease.
Yeah, we talked last night about there was magic in a bottle, in a sense, created by this emergency. Do you guys have any closing thoughts on how we can take that magic and make it happen outside of a crisis? When we just really, people may just need goods or may just need something delivered or, without an emergency.
For me, it's really all about not recreating the wheel, and I think failure for me would be Project Act ending once everyone has tests in their medicine cabinets and we can kind of say, let's move on. I think it's how can we use this partnership and apply it to other problems, societal problems. I think the most immediate one out there right now is can we do something on treatment? There's a lot of really interesting antivirals out there that I think could be really interesting. If somebody tests positive, how can we get a drug like Paxlovid into the hands of somebody who actually needs it? And so I think there's some immediate opportunities for action, and I think the worst thing we could do is kind of sit up here and be like, attaboy, like we did it, and not think creatively about not only long-term but also immediate challenges that we could potentially solve with this partnership we've developed.
Mm-hmm.
Yeah, and I guess to just expand on that, as you guys think about your closing remarks, is there any advice you would give to folks who do want to scale this out and make this sustainable for broader societal issues?
Well, maybe tying all of that together, I think the test to treat cycle to somehow be able to, it's got the same kind of, the therapeutic window in which you got to start Paxlovid is so short. If we I got to set up an appointment with a PCP, they're going to ask for a PCR test, and then they're going to do a prescription, and the whole thing is all for naught. So I think that's definitely an active area that we're all working on. But I think there's so many other things, discharges from hospital and needing things when you get home. We were just talking over drinks last night about, coming home and having infusion therapy kinds of things that we send people home early on, or, first time and second time moms with the goodie bag that ought to be waiting and sustained every week because you need it. Yeah. There's a whole series of things where this notion of using the idea how we receive goods, all such health and fitness goods, I think probably can benefit from this. And the other part that I think hasn't come up but is very important is the consumer is now engaged. And this idea of self-efficacy is one of the things we have a hard time with. They've already raised their hand in this model to say, I am participating in some way. Now, that has some risks. We have to work really hard on the communication side, on activating the consumer who happens to be disenfranchised, earning their trust. But the cool thing is, it's a little bit like once they start going to these kinds of tools and getting one thing, they're able to get another thing. And more importantly, what we're finding is that's how we're doing result reporting now. Because I think public health is going to, one of the problems we have created through our success collectively with at-home tests is folks have access to test results. But the first time, maybe HIV, we have similar technology. For the first time, the consumer knows their result, and it's not the urgent care, it's not the reference lab, and we in public health now have to figure out how are we going to find that information. So cajoling them, giving them a reason to share that data, it relies on, again, trust and being able to say, here's how to do that. And we're working with a lot of places to actually, when they use the widget and they get the test and then they get a SMS notification, we use the same widget to say, hey, if you share it, it'll help us understand where to bring resources, to bring meds to you, those kinds of things, and it closes the loop. And I think that's a really interesting frontier that can really enhance health outcomes for folks. Because otherwise we'll lose them. It's not enough to test, and other disease states too.
Yeah. Well, just building on that, I will tell you that Betsy's question is really an important one. We've had so many emergencies, and I've been through so many, from hurricanes to, H1N1, Ebola, Zika, and all sorts of other, calamities like, black plume over Houston and all sorts of chemical explosion. I will tell you, people come together in the middle of a crisis. The biggest challenge is how do you sustain that connectedness when the crisis passes? And I will tell you also, it's very difficult. Very difficult, because we go back to our silos. One of my colleagues called it, I adopted it, silos of excellence. We think we're the best at whatever we do, and we're doing it, but we're not interconnected. And so this is really where leadership comes in. And we've been, one of my favorite phrases is that we're really good at collecting the dots, and now it's our job to connect those dots. And we have to do that for not just policymakers, elected officials, we have to do that for individuals and, in our case, Washingtonians, to help them understand what we've gone through. But the biggest challenge that we have is this real concept of what this pandemic has meant for us as a nation. And I talk about this a lot, that there are two ways to end this pandemic. By the way, they both will see the end of the pandemic. One is to be transactional in nature, and the other is to be transformational. And transactional means that it's one and done, right? It's like we as Americans do all the time. It's the next shiny object, the next headline, and we forget everything that we collectively went through together over the last 2+ years. The other is to be transformational, is to say all of the summation of the experiences, good and bad, and how do we look at that and build transformative processes to build systems for a future. That's what we have started with Washington's WA Forward plan, is to really think about what is it, not just for COVID, but COVID and beyond. And we have to be thinking about what is beyond, because if we don't do this well, this pandemic will end, but the opportunity that crisis brings will be lost. And shame on us as Americans if that's what we see. And unfortunately, and I wake up optimistic sometimes, other times I'm pessimistic, and I wake up and I say, gosh, that opportunity is already slipping through our fingers. So it's up to us to really decide which kind of future do we want, a transactional one where we ended the pandemic, or a transformational one where we actually see all of those opportunities and challenges and we build upon those. And let's see what choice we make as Americans.
Fantastic closing remarks. I want to thank you guys very, very much for your time. And also for you all in the audience. Just a couple closing thoughts. Our Amazon multi-channel fulfillment team will be down here by the stage if anyone would like to dive deep on questions with them around this model or anything else. Also, we encourage you to get engaged with our certifications. You can get started by scanning one or both of the QR codes on screen. And then lastly, AWS craves feedback. So you'll be receiving a survey, and we encourage you to please fill it out so that we know how we did in this session and summit. Thank you.
Thank you.
Thank you.
Great job.